Hello friends, this is Pathology Discussion Forum and today we will be discussing cirrhosis. Now, why cirrhosis? Because after the end of the session, we will be able to identify the specimen of cirrhosis. Also, we will be able to answer the questions in the theory and practical examinations. Along with that, we will acquire knowledge about the microscopic features of cirrhosis. Now, first, let us recapitulate what are the basic points on which a gross specimen is described. First, the description should be brief and crisp. Next, always look around all the sides of the specimen even if you know the diagnosis. Finally, the organ to which the specimen belongs you have to identify also. Then describe the external surface with regard to the texture, color, capsule or any other changes. Then describe the cut surface or the luminal surface if it is present. And finally, you have to give one possible gross diagnosis along with the name of the organ or tissue. So, it is a specimen of liver having one external surface and one cut surface. The liver is identified by the size, shape and the texture of the organ, and there is presence of porta hepatis that is present over here. The external surface, that is diffusely nodular with presence of nodules of variable sizes along with areas of depression or depressed area in between the nodules. The cut surface is also showing the similar features. So, the possible gross diagnosis is cirrhosis of liver. Now, a brief recapitulation of the theoretical aspects of cirrhosis. It is defined as a condition characterized by diffuse transformation of the entire liver into regenerative parenchymal nodules surrounded by fibrous bands, and there is variable degree of vascular shunting. But it is defined histopathologically by presence of bridging fibrous septa, parenchymal nodules, and there is diffuse architectural distortion of liver. Now, moving on to the causes of cirrhosis. There are so many causes of cirrhosis, but the most important ones for your examination are alcoholic liver disease, non-alcoholic fatty liver disease, chronic viral hepatitis, biliary diseases like primary biliary cirrhosis, sclerosing cholangitis, and also cryptogenic. Nowadays, most of the cryptogenic cases are categorized in the non-alcoholic fatty liver disease group on further investigations. Now, a few words about the pathogenesis. First, there is death of hepatocytes. Then, the hepatic stellate cells are transformed into hepatic myofibroblast. Then there is extracellular matrix deposition by hepatic myofibroblast. Then the surviving hepatocytes, they proliferate and regenerate, which leads to formation of micronodule and macronodule. Also, there is variable degree of vascular shunting. Obliteration of the biliary channel leads to development of jaundice. Now, what are the types of cirrhosis? Cirrhosis is classified depending on the size of the nodules. It is micronodular when the nodules are less than 3 mm in diameter, and macronodular when the nodules are more than 3 mm in diameter. But the most common presentation is mixed. Diagnosis is made based on the clinical features like ascites, jaundice, radiological findings like diffuse nodulation of the entire liver, biochemical findings like abnormal liver function test results, and finally the liver biopsy findings. Here are the liver biopsy findings of cirrhosis. Here is degenerative nodule, and this area is highlighted by this blue circle, and these are the area of bridging fibrosis. This is Mason trichrome stained section nicely highlighting the areas of bridging fibrosis. These are the complications of cirrhosis, and among them bleeding gastroesophageal varices is the most common cause of death. Clinical features are jaundice, ascites, spider angioma, hypogonadism, altered sensorium, renal failure, etc. Now, let us recapitulate what we have learned today. So, it is a mounted specimen of liver having one external surface, one cut surface, and there is presence of diffuse nodulations, and these nodules are of variable size. Also, there is areas of depression or depressed areas in between the nodules, and the entire liver is involved. So, the possible gross diagnosis is cirrhosis of liver. So, at the end of this session, shall we be able to identify the specimen of cirrhosis of liver? I think you are saying yes. And finally, I have a quiz for you. Can you tell me what is the connection between a stethoscope and cirrhosis? And the connection is Dr. René Laennec, who has invented stethoscope as well as he has coined the term cirrhosis. Now, if you have any question, then post it in the comment section below. Now, thank you for watching this video. Share your opinion and please subscribe to Pathology Discussion Forum for more and more videos on pathology. Thank you.